69 News live at sunrise starts now.
Well, when you think varicose veins, you often think they're a problem for older women. But a local doctor says it's quite the opposite. Why he says more younger men are having vein problems when he joins us live. So when we think about varicose veins, a lot of us think they're a problem for women, usually older women. But a local doctor says think again. Dr. David Calcaño says his patients have changed dramatically recently. He joins me now to explain, along with one of his patients, Todd Cubison. Gentlemen, good morning.
Morning.
Thanks so much for being with us. So, doctor, talk to me a little bit about what you're seeing in your office. Your typical clientele, as I mentioned, has really changed a lot recently, right?
Well, although women still get varicose veins more than men do, up to 25% of the patients presenting now are males. I think this is likely due to some of the much less invasive procedures we have nowadays that allows men to get recover more quickly, as opposed to being off of work for several weeks, like with the older, bigger operations we did.
Yeah, and why is this happening? What's to blame for this trend, would you say?
I think it's the disease probably hasn't changed. It's just the less invasive ways of treating it, I think, are more appealing to men that previously did not want to be away from work or for any length of time.
Yeah, and other than the fact that, you know, when we think about varicose veins, we think they're not particularly attractive. Do they need to be treated? I mean, is there a medical danger associated with varicose veins?
Well, when varicose veins form, it's usually because there's some valve leakage in the leg, so the blood's actually going the wrong way, increasing the vein pressure in the leg. This can lead to tiredness, achiness, heaviness, those sort of symptoms. So it's not just a cosmetic problem.
Okay, so Todd, talk to us a little bit about when you first noticed your varicose veins and when they became a concern for you.
Well, I'm very active, so I didn't really have the visual, common visual vein issue, but my leg felt very tired, very achy, extra heavy, and through the course of that and me complaining about the pain, I was referred to the doctor here and had it taken care of with his new procedure.
Yeah, and were you surprised that it was so quick and easy?
Yeah, it was. It was a great procedure. It was quick. There was very little recovery from it. I was back on my feet and, you know, in no time, active again with no issue at all.
Great. And doctor, we have some video we're going to show now. Talk to us a little bit about this new procedure that Todd just mentioned. What is it exactly?
Well, the venous closure procedure is a radio frequency catheter which can seal off that leaky vein I was talking about. On the video, we're seeing that catheter being inserted through a small sheath under local anesthetic, and then local anesthesia is placed all around the vein to make good contact and to numb up the patient so they don't actually feel any of the actual radio frequency ablation of the vein.
Great.
All done as an outpatient. No anesthesia.
So no overnight stay or anything?
Not at all.
And back to normal relatively quickly, huh?
Yes, in fact, we encourage folks to go for a walk before they leave the office.
Wow. Okay, great. And we have some before and after pictures we want to show folks. And while we do that, you can see we have two sets of befores, and then you'll see the after in just a minute. Wow, that's pretty amazing. And is this almost immediate, doctor, or does it take some time to kind of disappear?
No, once you decrease the pressure from there's no longer any backward flow in the veins, then there's no reason for the veins to bulge and be tired and achy and heavy feeling.
Great, and we have one more set. And Todd, were you surprised that you were back to normal so quickly, and how is your activity level now?
Yeah, it was amazing. I mean, like right after the procedure, you take your walk, and it feels pretty normal. And you know, within less than a day, I was able to be up and active again and get back to my normal routine of exercise and, you know, whatever I wanted to do, back to work.
Great, and we should mention, while we're talking about men today, doctor, this is a procedure that both men and women can have, right?
Oh, yes.
Okay, great. And Melanie, our reporter, is out talking about giving this morning. It's Tuesday Giving Day today, and you guys are doing a little giving for the month of December. I understand there's some free screenings being offered.
Yes, we're having a screening. I think it's, January 21st and 22nd, afternoon and into evening, if anyone would like to call and make an appointment.
Okay, great. And we have more information on the website right there on your screen, VeinExpertsPA.com. Thank you both. And Todd, we're glad you're doing so well. Thanks for sharing your story. And doctor, thanks for all that you do. And we will be right back after these messages. Stay with us.